Health and Human Services Secretary Robert F. Kennedy claimed last week that the measles outbreak may be plateauing. But the highly contagious virus continues to spread mostly in unvaccinated people. And the CDC reports that the number of cases topped 700 in 2025 so far. The measles virus, which was once effectively eradicated here in America thanks to widespread vaccination, is now in 24 states. We spoke Friday with Dr. Peter Marks, the former head of the Food and Drug Administration's vaccine program, who was forced to resign last month as part of Kennedy's redesign of American health policy. Our conversation began on the subject of the measles outbreak and the response by the Trump administration. Secretary Kennedy spoke to my colleague, Dr. John LaPook, earlier this week following the death of a second unvaccinated child in Texas due to measles. Kennedy reiterated people should get the MMR vaccine. Take a listen.
What's the position philosophically of the federal government in terms of public health?
The federal government's position, my position is people should get the measles vaccine, but the government should not be mandating
Understand.
those. You know, I've always said during my campaign and every part, every public statement I've made, I'm not going to take people's vaccines away from them. Right. What I'm going to do is make sure that we have good science so that people can make an informed choice.
Is that a sufficient endorsement?
As a public health professional, I'm going to tell you what an endorsement of the measles vaccine sounds like right now. If you can hear my voice right now and you have a child that is unvaccinated against measles, we have measles spreading in this country very significantly. You wouldn't put your child in a back seat of a car without being strapped into their car seat. You want to get your child vaccinated against measles so that they don't have a 1 in 1,000 chance of dying from measles if they contract it. There's no reason to put your child at that risk because the vaccine does not cause death. It does not cause encephalitis, and it does not cause autism. So that's what an endorsement sounds like. Just make the comparison.
That has to be extremely frustrating for you as someone who worked in the vaccine space for so long. You clearly feel that this is safe and effective, and that not saying it clearly is endangering people.
Right.
Am
so
I understanding?
Another way, yes, no, exactly. But there's a whole host of people who can't speak out like I am that are saying, you know, this is a vaccine for which the benefits so greatly outweigh the risks that to not use it is the equivalent of, again, throwing, I mean, if you saw a child, if you saw a 15-month-old rolling around in the back seat of a car, you'd probably call Child Protective Services. Mm-hmm. Now, I'm not saying we should order parents to do this, because I don't want to get into the whole issue of mandates, but we should have a moral responsibility to protect our children against something that could potentially be life-threatening, particularly when it's spreading across the United States the way it is.
You said there are people like you who can't speak freely. You can speak freely because you're no longer at the FDA.
Correct.
You're saying your former colleagues can't directly answer a question, they can't honestly answer a question and endorse a vaccine right now?
I think it's challenging in this environment for some of them, but you'd have to ask them directly.
Yeah. In your resignation letter, you wrote of the measles outbreak and what happens when confidence in science is undermined. You said it's clear truth and transparency are not desired by the secretary, but rather he wishes subservient confirmation of his misinformation and lies. Did you ever speak to him about your concerns?
So just a matter of record, I never interacted with the secretary. I don't intend to engage on disputing any of that. Its administration can have me come and go, that's fine. The more important thing here is that we deal with the issue at hand, which is vaccine confidence is really important for this country, and it's been undermined over and over again over the past years, and now we're seeing the result of this.
You are saying here that the man running HHS doesn't take in information, wishes subservient confirmation of misinformation and lies. There's presumed outcomes, is what you're saying.
I think that my words then spoke for itself. I don't need to belabor it here. You know, science is the pursuit of objective truth for the benefit of mankind. And those of us who believe in it, we take it very seriously. And it hurts us deeply when there are those who would undercut the name of science, undercut the very name of science because it's convenient for them to purvey lies. And that's just, it's not okay, because at the end of the day, I was so strongly affected by what happened last week with the death of a second child that I actually used profanity with a reporter while I was on the record without realizing it, which is something I've never done. I don't believe that we should be saying, well, these are people who believe that they shouldn't be vaccinated, because my experience, the Mennonite community, my experience is that if you meet people on their level, they generally will eventually come around.
Many parents probably know ASD diagnosis rates are on the increase in this country. The CDC says the current numbers are 1 in 36 American children. This is a very broad spectrum of neurodevelopmental disorders. There's no established cause. On Thursday, the HHS Secretary Kennedy said he's got hundreds of scientists from around the world working on it, and he promised this.
By September, we will know what has caused the autism epidemic, and we'll be able to eliminate those exposures.
That gives tremendous hope to a lot of people. Do you know anything about that ongoing research?
I know a minimal amount of effort that's being going on to try to relook at prior autism research, but I'm not aware of what is being discussed there. I cared for leukemia patients for a significant number of years. Giving people false hope is something you should never do. It is absolutely, you can be incredibly supportive of people, but giving them false hope is wrong. If you just ask me as a scientist, is it possible to get the answer that quickly? I don't see any possible way. And remember, you're talking to the person who came up with Operation Warp Speed for vaccines. Autism is an incredibly complicated issue. So we have the issue of diagnosis bias. We don't know how many of those cases are true, how much of this is true growth of autism, how much of this is just that we now have diagnostic criteria and we diagnose it more often.
The President of the United States said something artificial is causing autism rates to go up. On Thursday, he said, maybe you stop taking something, you stop eating something, or maybe it's a shot. But something's causing it. Right after that, RFK appeared, the HHS Secretary appeared on Fox News and dismissed 14 studies that have shown no link between autism and vaccines. He said it is an epidemic.
Epidemics are not caused by genes. Genes can provide a vulnerability, but you need an environmental toxin. So we know that it is an environmental toxin that is causing this cataclysm. And we are going to identify it.
Is there scientific evidence ruling out genetics as a cause of ASD?
There's no scientific evidence ruling out genetics. In fact, there's data that have been published that say that genetics may contribute to autism. There are obviously data that suggests that perhaps environmental factors may, but one has to be incredibly careful about making associations between environmental factors and autism. There's a wonderful graphic that shows that Coca-Cola increase goes along with the increase in autism. But there's also a wonderful graphic that you can find online that shows that the increase in spending on organic food also goes along with the rise in autism. False causality. Scientists do not want to find false causality. We want to find true causality.
It stood out to us that Secretary Kennedy has hired someone named David Geyer to conduct analysis of the links between autism and vaccines. He was charged by the state of Maryland in 2011 with practicing medicine without a license. That was weeks after his father's medical license was suspended for putting autistic children at risk by giving them a hormone blocking agent. So, what should the public know or expect from the work that he will do? for the U.S. government?
So all I can say is I would not concede. He's, to the best of my knowledge, he's not had any training after college in any of the sciences that we value here. What I think we can expect is the expected, that there will be an association determined between vaccines and autism because it's already been determined. This is not how science is conducted.
You can find our extended interview with Dr. Marks on our YouTube channel or on facethenation.com.